All opinions expressed are that of the individuals interviewed and do not represent the views of any employer or organization. Demonstrative of user experience only.
My name is Firuza Payami, and as a caregiver for my parents, I constantly have to visit hospitals and a specialist on a regular basis. Especially my dad recently has been diagnosed with Alzheimer, and he also have a brain tumor, and I had to go and do a follow-up with a neurosurgeon. And you can only imagine taking my dad to a neurosurgeon with a fractured hip, Alzheimer, and being very dependent on me and not understanding what's going on, how challenging it could be. Once we got there, we realized that the information was not there. It was not sent by the family doctor, even though that my father was referred by the family doctor. They did not have any of his information, any of his MRI result, any of his pathology result on chart, so they had to return us back and ask to follow up with the family doctor to make sure they have all the information in order for my dad to have a proper follow-up.
My name is Michelle Massino and I work for Dr. Eric Mascott. At times it can be quite challenging. Patients don't always have all the information from the one specific doctor. They'll have different specialists that they've seen in the past, so they tend to forget where they've been and where they've gone. So it is challenging for us as an office to kind of collect all that database so that we can have the complete picture here for the appointment. We do actually have a lot of back and forth. We will request for an MRI, we will request for more clinical information, and if that information is not provided to us, we keep requesting it from the referring physician's office, and they sometimes don't have it because it's coming from another office or the reports are printed off for them, so that does cause a little bit of a delay for the patient. We have patients who are sometimes referred to us, let's for example say March, and we're still kind of getting the back and forth business because the other doctor's office is kind of still scrounging up that information or the patient.
My name is Eric Mascott. I'm a neurosurgeon. You don't want the patients to waste time having to chase around all these different bits of information, and you don't want the clinicians or the physicians looking after these patients to have to wait or have to reorder tests and incur more cost onto the system and slow everything down for everyone else. You want all the information to be accessible right away. Talk about a system that requires information from several different stakeholders. Having this information all together can sometimes take several weeks or months. So this inefficiency really kind of has a major impact on our ability to make decisions, and this impact is felt in terms of the quality of care that the patients receive. So what I'd like to sort of suggest or really strongly recommend for people who are building the architecture behind all of this is to think about how do we engage all of the possible stakeholders. Obviously the patients, the physicians, but those are not the only individuals in this circle of care. There's nurses, nurse practitioners, allied health, occupational therapists, physiotherapists, chiropractors, and the list goes on and on. I think all of these individuals should be given some access to this information so that when they make recommendations, they can make recommendations on a complete picture, not a limited and narrow vision of what they're being presented with.
Hopefully in this perfect world, this project will get off the ground and everything will be on a database where across the board all the physicians can get access to it. It would be so awesome.
So if you just state your name and who you are.